Thank you. Well, welcome. Thanks for coming tonight. I know lots of you have come from far away to be here, and we certainly appreciate having you here. And we appreciate the opportunity to tell you a little bit about what we do here at Western Bariatric Institute and a little bit about weight loss surgery. Tonight I'll say a little bit about the history of weight loss surgery, not too much, not too boring, a little bit about today and the options that are available today. In the past we only had one type of surgery, and today there are really two that are vying for equal billing really as good possibilities, very effective treatments that are weight loss surgical procedures approved today. And we'll mention a third procedure that's new on the horizon as well. So we'll say a little bit about the problem. In the past, I think that the medical community has kind of dropped the ball a little bit about really providing effective treatments for this problem. In the past, I think we viewed weight gain as being perhaps something less than a true medical problem, but today we realize how important it really is in causing trouble for us, physical problems, emotional problems, shortening our life expectancy, and certainly decreasing quality of life. So it's something that now we really have full engagement of the medical community, and the weight loss surgical procedures have proven to be very effective, especially effective in combination with a program and some support people who are there to coach you and cheer you on and guide you through the process. That combination is a very powerful one. And the third piece, which is the most important piece, is really you. The person who chooses to do it is really the key ingredient, and that hard work and effort and putting your heart into it is what makes it truly successful for the long term. I hope in the process you'll meet many other people who've come before you and have gone through this process and have successfully lost lots of weight and improved their lives. It's something that really is wonderful, and it keeps us going. It's very exciting for us to be a part of it. Our center, we have been doing weight loss surgery here for a number of years, approximately 8 years now. We were one of the first 100 or so centers of excellence designated by the American Society of Bariatric Surgery in the country, and we continue to participate in that designation. That requires us to do a lot of reporting and maintain a high standard with respect to many aspects of this whole process and with respect to surgical weight loss. There are 4 surgeons, myself and 3 partners, Drs. Ganser, Kozar, and Watson, and all of us are very dedicated to this process, and we are, one of the benefits of having 4 surgeons is that there's always one of us around available, and so we can have 24/7 coverage all through the year, and it's not the case where we have someone covering who's not a bariatric surgeon and who may not really fully understand the details of this kind of procedure. There are many people who play a role in this program, many of whom you won't meet, some of whom you will meet, and many of whom are working very hard on your behalf, sometimes behind the scenes and sometimes together directly with you. But all of these folks listed here are very dedicated to your success. So what we're talking about nowadays is minimally invasive surgery. How many people here are familiar with the term laparoscopic surgery? Have you all heard that term, right? How many people here know somebody who's had laparoscopic surgery or have had it themselves? So most people nowadays. This has really been one of the main revolutions that's taken place in healthcare across the board, is this movement to less invasive surgical intervention. And we now accomplish a lot of types of procedures, even cancer surgery, gallbladder surgery, hernia surgery, many things done now with a less invasive laparoscopic approach. And this leads to less complications, many other risks are diminished, and we've been able to do more and more complex surgery over time, including things as complicated as Roux-en-Y gastric bypass operations, which are pretty involved surgical procedures, but now can be done with very small, minimally invasive technique and a very short hospital stay and very short recovery time. We've also seen a very dramatic reduction in the risks and complications associated with weight loss surgery over the last 2 decades, and that continues to happen today. Paralleling that, we also see a very marked rise in long-term papers and data demonstrating the effectiveness of weight loss surgery. Many studies now show long-term outcomes with dramatic health improvements, gains in life expectancy and quality of life. over time. So we're at a time now where we have the intervention, the treatment has become less invasive and safer than ever, but at a time also where the data is quite compelling that the surgery itself and the programs that help work with people after weight loss surgery provide more effective solutions than we've had before as well. So it's a good time to be thinking about this. There are very good options available, and I'll talk about both the risks and the benefits as we move on. This problem today, as all of us know, just looking around, has become very pervasive. There are many people today who are suffering with weight gain. It's very difficult to get rid of, and more of us are suffering with health problems related to weight gain. Today, around 2/3 of people are either overweight or obese, as determined by the body mass index, and an increasing proportion of children are now overweight as well. Something that we're working on with the Obesity Prevention Foundation, and something that I hope you'll hear a little bit more about as you join us in trying to lose weight and get healthier yourself, but also think about how we can make a difference for young people in our community. And around 5% of people meet this designation that is termed morbidly obese. It's not a term that we really like, but it's a term that's come from historical studies in which the body mass index was used to categorize all of us based on our height and weight. How many people are familiar with the body mass index, or BMI? Is that something that everybody knows? Does everyone know their BMI? Are we? Yeah. So nowadays, just about all of us kind of know our BMI at some point. Back when these studies were being done and the discussions about weight gain and obesity were being conducted, the body mass index was being used to help sort of stratify all of us. And if the body mass index was over 25, we were considered overweight. If the body mass index was over 30, then we're considered obese. And if it's over 35, then we're considered morbidly obese or seriously obese. And that has kind of paralleled the development of treatment strategies, so that weight loss surgery has become a treatment when the body mass index is over 35 in most cases. And the insurance plans generally have gone along with that. The federal government plans, Medicare, Medicaid programs generally cover or reimburse or pay for weight loss surgery as an effective treatment when the body mass index is over 35. They do put some conditions sometimes, and if the body mass index is over 40, then generally they don't have any special additional conditions or requirements. But if it's over 35, they will cover it, generally speaking, if there are some demonstrable health effects already taking place, particularly high blood pressure or diabetes or obstructive sleep apnea, that sleep disturbance, snoring problem. But sometimes many of the other conditions as well will, in the eyes of those folks paying the bills, will warrant weight loss surgery. So this has kind of evolved in that fashion over time. The really troubling thing about this obesity epidemic is that it is not a cosmetic or social issue or something that is less than fully deserving of our medical efforts and our best attention, because so many people develop health problems, and the health problems are quite severe. And as you've probably read in the media and the paper, weight gain and obesity are now either the #1 cause or soon will be the #1 cause of premature death and disease in the whole country. So it's really a big problem. It's not something that can be overlooked or pushed to the side anymore. And it's a relatively recent problem as well. The obesity epidemic really only dates back 30 years or so. At that time, we had a relatively low proportion of people who qualified as having this high body mass index. But over time, as you see, we fast forward with the data in the United States, the states that become shaded more darkly have a higher percentage of people with obesity in the state. And as time has gone on, it has become very dramatic, and more states now have over 20%, over 25%, and now we're seeing many states with over 30% of the population with obesity. So quite a striking phenomenon, and one that has quite severe health effects throughout the state and on state budgets and on how we administer health care. So with lots of ramifications. The person mentioned that obesity could be hereditary. Well, I think in a way it's hereditary in the sense that we are all of us probably designed to very avidly and effectively hold on to calories that we take in. It was probably a real survival advantage when there was a long time between harvests or a long time between hunts, say. And so more and more, the science indicates that we are designed to hold on to those calories and store them, but we store them as fat. And in an era where calories have become so common and so cheap and so delicious and so pervasive, that is turning out to not be a big advantage. It's actually turning out to be a disadvantage. And we're taking in more calories. Our bodies are still holding on to them very successfully and storing them, but that leads to more problems, more complications like diabetes and so forth. So our genes have not changed in 30 or 40 years. Our genes are all the same. That's going to happen over thousands of years or tens of thousands of years. But what has changed is the environment around us. So the environment around us has changed markedly, and we find ourselves getting less exercise, doing less physical activity, and consuming more calories. And the calories that we're consuming may be somewhat hidden from us. We may not realize we are always consuming more calories. Sometimes the portions have become larger. The plates that we're buying have become much more calorie dense and calorie rich. And we as consumers like that, and we buy more and we consume more. The environment has really led us in this direction and made it much harder for us to stop the weight gain. So yes, I think it is genetic in the sense that we're designed to gain and store energy. But it's probably something that's universal to almost all of us. Some people are going to have an even greater genetic predisposition in which everyone in their family has been overweight or obese. But really all of us will share most of these traits. So the real question is what to do to reverse that. We can't change our genes. We can't change who we are biologically. But we can change how we think and behave and what we do. And now with weight loss surgery, we can change how hungry we feel, and we can have an extra tool that's on our side to help us get the weight off. It doesn't let us off the hook from doing the work ourselves to lose the weight and keep it off. It's very important that when you embark upon something like this, you realize that at the end of the day, it's your responsibility. You're the one who's going to make this successful. There are plenty of people who have weight loss surgery who are not successful with it. It's a big study that showed 89% of people keep the weight off long term. That was the findings of a long-term research study after weight loss surgery. 89%. That leaves 11% of people who gained back significant weight. And out of hundreds of thousands of people having the surgery, that's a lot of folks that you may run into who have regained weight, even with modern weight loss surgery. So it speaks to the fact that you can still gain weight, you can defeat the surgery, you need to really put your heart and soul into losing the weight and then keeping it off. So part of our mission is to give you those tools so that you can successfully do that. You can lose the weight and keep it off. Most people do, and you can do it. But it helps a lot to have people on your side and have a team working with you. So just a disturbing statistic that with that high body mass index, our life expectancy is markedly lowered. And these are the clinical terms that used to describe weight gain and obesity. As I mentioned there, if the body mass index is over 30, then that's the term that has been around a long time that describes obesity. And if the body mass index is over 35, then this is the category where weight loss surgery is generally thought to be appropriate. Increasingly, we've seen studies that have examined weight loss surgery in the body mass index of 30 and greater, particularly with the less invasive lap band procedure or laparoscopic adjustable gastric band procedure. Many studies showing that this too will be very effective for the lower body mass index range of 30 to 35. Now that has implications for the insurance companies and whether or not they would pay for it at that level. That brings in millions more Americans and lots of people around the world who would then qualify if the body mass index of 30 is used as a criteria. But I think that's certainly coming. The studies are very compelling that certainly for people with health conditions and a body mass index over 30, they stand to be quite a bit better off in terms of all of those same endpoints: better health, healthier weight, greater longevity, and greater quality of life if they undergo weight loss surgery with that body mass index over 30. Right now, though, the insurance plans are reluctant to pay for that, and only in very unusual cases will it be paid for at that lower BMI level. So that's something that we expect will change over time in the future. But of course, has implications with the insurance plans and who pays for it. So quite a number of medical conditions are associated with weight gain and obesity. Probably the top one is type 2 diabetes. In addition, many other health problems are related to weight gain. In fact, weight gain and obesity are often the #1 risk factor for a great many problems, including early heart disease, high blood pressure, obstructive sleep apnea, and a long list of other things. So you can see why obesity is such a costly and troublesome condition. It leads to many other conditions. It's not just a problem in and of itself, but it's all of the things that take place afterwards and all the health problems that result. This is just an indication of a typical cost associated with living with obesity. It's quite significant. This is one of many studies. There are now, probably 5 good, large, long-term studies examining the survival or mortality risk among people with obesity and comparing large groups of people who choose to undergo weight loss surgery and comparing them to the people who don't undergo weight loss surgery but presumably continue to work at it with other means available. Unfortunately, those other means have not been very successful. It takes a very dedicated, comprehensive program to make a dent in this obesity problem, where you really need to pull together a team of people, psychologists, physicians, nutritionists, exercise therapists, and probably some life coaches, trainers, and other people too, to really tackle this effectively. So it's very difficult without weight loss surgery to achieve much success. And in this large Canadian study, the mortality risk reduction was quite dramatic over a 5-year follow-up period. And you can see that the people who had weight loss surgery had this marked reduction in their mortality risk over time. And this was comparing a little shy of 7,000 patients involved in the study. So very dramatic data, and over time I think we've seen this reported in the media. There was a large or widely circulated Wall Street Journal article that talked about the effectiveness and the survival advantage after weight loss surgery compared to not having weight loss surgery. And slowly I think that story is getting out. In years past we saw all the media coverage had to do with sort of strange and unusual complications or plastic surgery related to it, or a lot of things that were, I think, perhaps interesting, but really did not reflect the main message, what is taking place, where this procedure is making a very successful impact in what is really the most troublesome, frequent, and deadly health problem of our time right now. So that message is getting out there, and this is just one example of that sort of data. So let's get to the surgery. What kind of procedures are there? Well, today, as I mentioned, there are 2 procedures that have been very successful and have quite a bit of long-term data associated with them. One is the Roux-en-Y gastric bypass, and the second is the adjustable gastric band. Both of these are performed with a laparoscopic technique or a minimally invasive technique in almost all cases, probably 98 or 99% of cases. The third procedure that has come on the horizon recently is called the vertical sleeve gastrectomy. I won't say quite as much about that. It's not often covered by insurance plans, and we don't have much data now beyond a few years follow-up at this point in time. But many people think that it will be a promising alternative as well. These diagrams depict the 2 most common procedures and those with the long-term outcome that demonstrate a great deal of effectiveness and that result in long-term gains in survival, quality of life, and health. The Roux-en-Y gastric bypass is depicted here. A small stomach pouch is created, and the roux limb or bypass limb of the intestine is brought up and connected to it. And so as we eat, food comes in here, and this small stomach pouch fills up. We feel fuller, and we have less hunger, greater satiety. And then a little bit of absorption impairment takes place. So some of the calories we take in are not absorbed. This leads to further weight loss. It also leads to the potential for some vitamin or nutrient deficiencies that we then need to be aware of. This diagram here depicts the adjustable gastric band, in which the band is placed around the upper stomach and a small access port is placed down at the muscle level of the abdominal wall. There's nothing external, but that allows us to add some fluid and slowly tighten or adjust the band over time. And so this too has proven to be a very effective treatment and one that's a little bit less invasive. It doesn't involve quite as much surgery, doesn't have some of the risks associated with gastric bypass surgery. Here's a little bit more about the Roux-en-Y gastric bypass. A couple of the important points are that the small stomach pouch is completely disconnected from the rest of the stomach, and the rest of the stomach continues to work and do its jobs. It's still creating enzymes, it's still creating digestive juices, and those flow down and become part of our normal digestion. Generally speaking, people do report that they feel fuller, they feel a greater sense of satiety and satisfaction eating much less calories. So it really helps your own efforts as you work hard to reduce your calorie intake, and particularly to reduce the sweets, the carbohydrates that you're taking in. This surgery helps markedly in making that easier to do, making you more successful in your efforts. And here's one study out of the Journal of the American Medical Association demonstrating marked improvements in health problems. Most notably, of course, diabetes is always listed as number one. Since that's such a serious health problem, what a high percentage of people experience total resolution, where they're no longer taking any medicines at all and their blood sugars are normalized. The same is true for many other health problems, and the top 3 or 4 are listed there, including sleep apnea, hypertension, and hyperlipidemia, all of which are resolved in a high fraction of people or improved in a good percentage of the remainder. So if there are advantages to the gastric bypass, I would say that it is the procedure that has been around the longest in the United States. It's one with the longest track record in the United States, with studies going out 20, 25 years and anecdotal data even beyond that. There's no implant. There's nothing external that's placed. Some people don't like the idea of a foreign body or a foreign gizmo that's an implanted device. If there are disadvantages, I think that it's a technically more difficult operation. It's one that involves cutting and rerouting of the stomach and intestines. And it does have higher risk of surgical complications or problems as a result. These are not frequent in the hands of an experienced surgeon, but they do include things like leaks at the connection points, bleeding, say from staple lines or other areas where the surgery is conducted, or scar tissue that might form blockages or other problems. And there is also a risk of ulcers. This is irritation of the inside of the stomach lining, and that can occur after any sort of stomach surgery. It can occur in any of us, just mostly from taking Motrin or Aleve or ibuprofen. Those medicines are real tough on the stomach lining. But that lining becomes more vulnerable after gastric bypass surgery. So one of the things we strongly recommend to everyone who does undergo gastric bypass surgery is to strictly avoid Motrin, Aleve, ibuprofen, all of the non-steroidal anti-inflammatories. We'll tell you that 3 or 4 or 5 times in the course of the whole process, but tonight is at least the first time, unless you've heard that before. So no Motrin, no NSAIDs after gastric bypass. There are other risks as well, and I mentioned or alluded to the risk of vitamin and nutrient deficiency after gastric bypass. It may seem ironic that we are nutrient overloaded in a way and gaining too much weight and storing that energy as fat, and then would have a procedure in which we are now nutrient deficient. But in fact, that does occur, and because of the nature of the bypass, there's a decrease in absorption of some vitamins and nutrients that's important. Now that can be counteracted in almost everyone by taking vitamins and supplements that we recommend. But chief among the list are vitamin D, vitamin B12, and to a lesser extent iron and some of the other B-complex vitamins. So it's very important that you take the vitamins we recommend if you've had gastric bypass surgery. And we continue to reiterate that. That's a lifelong need, something you'd want to take forever and ever. So those are a few of the pros and cons of the gastric bypass operation. And we hope that you'll meet many, many people who've been here. There have been close to 4,000 people at Western Bariatric Institute who've undergone weight loss surgery of some kind. And at the annual fashion show and other events, the support groups, at the May 2nd Reno Rock and River 10K half marathon and marathon race. I hope that some of you will come out and walk or run or participate. We're sponsoring the kids race this year to raise awareness of childhood obesity. But I hope you'll see lots of people like this and become one yourselves. Many of the folks who've had gastric bypass surgery here, and they've been generous enough to share their stories with people, and you may see them and others at the fashion show and other places. So let me transition now to the gastric banding procedure. This has now become the most frequently performed weight loss surgery in the world, and it has been more widely performed outside the United States. After 2000, when the lap band got approval by the FDA, we've seen the lap band grow in popularity in the United States as well. And in years gone by, I think that we continued to point at data that showed the greater weight of long-term evidence in support of the gastric bypass surgery. And in more recent years, we've seen more and more studies that have shown that the long-term weight loss results of the lap band are very comparable and probably equal or indistinguishable from that of the gastric bypass operation. This is something that requires not only you putting your heart and soul and effort into it, but us also being there to support and do the band adjustments and counsel and coach and cheer you on over time. And I think perhaps more so, possibly, than the gastric bypass, we're not sure, but those adjustments and that continued follow-up may be a critical feature that allows those weight loss results to be equal among the two procedures. So I'll say a little bit more about that here. People tend to feel full, they tend to feel a lot less hungry, and tend to, again, be very helped and supported in their own efforts to cut down calories, cut down carbohydrates and sweets, and stay on their own plan to exercise and lose weight. That's a very effective weapon in the battle. No surgery is going to fight the fight for you, but it's a very effective tool for you to use. There are two manufacturers of the gastric bands. One is the lap band, and that's by the Allergan Corporation. They've had a very recent innovation to make a new band that's called the AP band, and I'll show you pictures of that in the office if you're interested in that, and we have a few models of both of them. But it has a new concentric kind of pillowed 360-degree balloon system that seems to have eliminated the problem of the harder components of the bands rubbing or eroding into the stomach tissue. It's also made in a way that's meant to prevent slippage of the band. They both share many features in common and have a tubing that connects to this port that we call it, which is placed down at the muscle level on the abdominal wall. And that's the way that we access it. Almost always done in the office, just takes a few minutes, and we can add a little saline and the band will tighten up. So that's helpful because as you lose weight, you'll see you're tightening up your belt, right? You're losing fat, you need to take in your pants, hopefully you get to buy some new clothes, some good things. But that belt around your waist is indicative of fat melting away. Well, the same is happening with the perigastric fat, the fat around your stomach. And so you'll want to tighten the band as well as you continue to lose weight. And that way you'll continue to feel that sense of restriction and that sense of satiety, that less hungry. And also, I think the second way that it's very effective is in our portions, helping us control our portions. It's nice to feel less hungry during the day, and that helps us keep out of those calories that crop up in the middle of the day when we walk by the donuts or the snacks or the things that are always around us. But also having help with our portions is very effective over time because when we do sit down to eat, we are able to stop and slow down with a far less calorie intake at that single sitting. So in both those ways, I think both in portion control and in decreased appetite, the lap band has been very effective. So here's a study. This one is going out around 5 years, demonstrating the body mass index and how it continues to diminish over time. So one of the things that many of the early studies showed when comparing the gastric bypass to the lap band was that after a year or two, or in some cases 3 years, the gastric bypass patients had more successful weight loss. But what we really learned over time is that the weight loss ultimately is probably the same. It just takes a little longer to get there. So there are some cases where people have a very compelling need to lose weight quickly. They have a particular health condition or a need for a surgical intervention or something like that. And in some cases, it may make sense to do the procedure that would allow the fastest possible weight loss. And in most cases, all the studies would suggest that that would be gastric bypass surgery. But for most of us, our goal is long-term health improvement and long-term weight loss and long-term weight maintenance, feeling better, living longer, and having a better quality of life. And so in that case, I think it can take we can take a judicious look at all of the data and kind of weigh that. In most cases, I think the weight loss results are pretty similar. Here's one study demonstrating just that very fact. This is a study comparing Roux-en-Y gastric bypass to laparoscopic adjustable gastric band. And you can see that the weight loss in the first year was greater after gastric bypass. Around 70% of the excess body weight was lost. And then at year 2, the gap had narrowed. At year 3, it had all but diminished. And at year 4 and beyond, it's probably about the same. So in the long term, it probably has a lot more to do with us as individuals and how hard we work at it and the habits that we create to keep that weight off and to stay on a healthy track. So very interesting data, and this is also reported in many other studies. This is data that I like to show because this is a study that we participated in. One of a selected number of practices around the country have participated in some studies that have gathered data about all of the procedures. This one was specifically related to the lap band. And it is also an early study examining this new band, the new type of band that I was showing, the lap band with the new 360-degree balloon design. And it has demonstrated very effective weight loss over time with follow-up looking out all the way out to 48 weeks of follow-up with even at that approximately just shy of 1 year follow-up seeing 47% excess body weight. So it's quite significant weight loss over a relatively short period of time, and we're pretty excited about that and happy to be one of the participating centers. So if there are advantages of the lap band, it would be that it is less invasive, so you just don't have the kind of potential surgical risks and complications associated with it. I think people, it's a same-day surgery, so it's an outpatient procedure. People can come in and have it done. It takes about 30 or 45 minutes in most cases, and people are able to go home the same day. Most people are able to return to work and activities in a very short period of time, you know, a few days to a week in most cases. And if there were troubles with it, that it could be reversed, it could be removed. You generally haven't burned any bridges at that point. If there are disadvantages, I think the disadvantages are that it does require that long-term commitment to follow-up and to have those band adjustments performed. Those are generally, as I say, just take a minute or two in the office. My nurse practitioners and physician assistants do the vast majority of them, and they do them very skillfully and without much pain and suffering. Usually numb up the skin a little bit, and it just takes a minute or two. In rare cases, we have people go to X-ray and do a fluoroscopy or X-ray guided band fill or adjustment, but not too often. Another disadvantage is that it does involve an implanted device, an implanted medical gizmo, so it doesn't have too many special concerns other than that, but for some of us that's not something we look forward to. It's not a perfect solution either. The band itself can slip or move or migrate in unusual cases, or the band could erode or rub against the stomach tissues itself. The port could become dislodged or require us to go back in surgically and restitch either or any of those things. Or it could have to be removed over time. These are not common, but they're all potential problems with the band, just like with any kind of surgery. The weight loss tends to be slower in the beginning. Although that latest study demonstrates very rapid weight loss in the first year, in general, the weight of all of the evidence over time has shown that the weight loss tends to be a bit slower over time than after the gastric bypass surgery. So you tend not to have that really rapid drop in that first 12 months like you often see with gastric bypass. And I'll say a little bit about this latest procedure. How many of you have heard of vertical sleeve gastrectomy? A few people? Anybody here really interested in it, that they've read up on it and become enamored of it? No, I'll describe it a little bit. This procedure has come on the horizon recently, and It has some popularity among some surgeons right now in the country, and I think may have a role to play over time. I think we'll see as time goes on whether the data stands up over time to compare with the long-term data of the band procedure and the gastric bypass. It's the only procedure that involves removing a large portion of the stomach. And so what you see depicted here is that this whole part of the stomach is actually taken out. And what's left behind is a long tube-like or sleeve-like stomach. And that is meant to act in the same way as the small pouch of the gastric bypass or of the small restricted stomach of the band. Smaller capacity, we feel fuller, we're able to consume less calories, and hopefully use that tool effectively to not only lose the weight but then keep it off over time. What's not known is what's going to happen over time. So we will see. The data is really not in yet. I think around the country there are mixed opinions about it. I certainly have an open mind toward it over time, but at this point we don't know whether that long tubularized pouch is going to stretch a little bit, a few percent in a few percent of people, or a lot, a large percent in a large percent of people. We just don't know. But the early data looks pretty convincing that it is similar in terms of its weight loss results to the other procedures in the short term. If it has advantages, it would be that it's less invasive than the Roux-en-Y gastric bypass. You might think of it as probably kind of intermediate between the two in some ways. Although it does involve removing a large part of the stomach, that makes it a quite irreversible procedure. We've also seen some troubles with the staple line and the risk of ulcers being quite significant there. As I say, there's still some disagreement about how severe some of these troubles are going to be and where exactly it will land in the grand scheme of things. In most cases, it's a bit early and most of the insurance plans are not covering it, and with rare exception, not too many folks are hankering to have that surgery at this point in time with the two other good options out there right now. There are risks associated with any surgery. I think everybody knows that, but we go out of our way to really try to enumerate what they are and then also put in writing in more detail at later steps, show pictures, and then invite you to look at the online illustrations and animated programs that also describe the potential hazards of surgery and what we do in surgery. But these include everything from death and very serious complications to less serious problems that are more easily fixed. But they include things like infection or bleeding. I mentioned leaks at the connections, problems with the surgery itself, scar tissue, blockages, having to go back or reoperate, or having to make an open incision. With the band, having troubles with the band itself and the hardware in some fashion, or having to go back in and replace or repair or restitch, any of those kinds of things. In the vast majority of cases, we can identify and solve the problems and still achieve our goals of helping you achieve your goals of long-term weight loss, better health, better quality of life, all of those things. I think that I've mentioned a few times that you play such a key role in the whole process. In fact, the most critical role really is you and how hard you work at this and how much you put your heart into it. So I really want to invite you to put your heart into it and really make a commitment to be successful at this. No one's going to do it but you. No one's going to make the right choices but you, and no one's going to exercise and make changes in what you eat and drink. No one's going to be able to do those things except you. We are very enthusiastic supporters and cheerleaders and coaches, and we've got a lot of experience helping people just like you be very successful at this. The vast majority of people do lose weight and keep it off and achieve those goals that they laid out in the beginning. One of the first things that I tell people, and one of the first things I ask you to do in my book, is to ask yourself, what are your goals? What are you trying to achieve? It's not mine, it's not our goals of curing diabetes, which is fantastic, that might be one of yours, or seeing the percentage of weight loss. But what are your goals? What personally would you like to see happen in your life that's not happening now that you know you could do? Things that kind of help you see or identify how you can really be the person you are inside, and things that you can do, people you want to interact with, be a better dad or mom, or interact with your kids, children, brothers, sisters, family. Those are the things that we really keep deep and hold on to. And those are the things that really help us succeed. Those are the things that when it gets tough and when we're stressed and work and lots of things are going on that we would normally turn to food for, we can reach back to and look at and use as motivation to help us be successful at keeping this weight off and staying healthy. So take a little time to think about those things for you. One of my early patients told me that her greatest goal was to ride horseback with her granddaughter. She had ridden horses as a young girl herself, but as she had gotten heavier and heavier, she just wasn't able to do that anymore. And her own daughter had children and now had a young granddaughter, and my patient loved her to death and wanted to play with her and do things with her. And more than anything in the world, she wanted to be able to ride horses with her as she grew up, and it just wasn't in the cards. It was not possible at her weight anymore, and she knew it, and she wasn't going to get there. And I asked her to really hold on to that and remember that, and hold on to that during those tough times when life's stresses are there. They're going on, and it makes it hard to stick with the program and to avoid dipping into old bad habits and consuming a lot of calories or starting to take up snacking the wrong kinds of things. And after her weight loss surgery, I think she did that. I think that she thought about that a lot, and she told me not too long ago that she had met that goal and succeeded and sent me pictures of her riding horses with her granddaughter. So pretty cool stuff. So you've got those things in your life that you know are important to you and your family, and I just ask you to think about those. Lastly, I'll say a little bit about the Obesity Prevention Foundation. This is something we started in our community a few years ago, and we go do programs and speak in the Boys and Girls Clubs and in schools to some extent. We're hoping to make this an even greater effort in the schools in particular, but it's something that we may ask you to get involved with as time goes on. And coming up soon, as I mentioned, is the Reno Rock and River Race, and we're hoping to make a big splash and raise a lot of awareness for childhood obesity in our community through that event. And I'll stop there and take questions. I don't believe there have been reports of true allergies with the lap band. It's a biologically inert or inactive material, just like other hardware material that is involved in orthopedic implants and many other things. So it's not felt to be biologically active in the sense of a true allergy. There are people who've had the band and port removed, and they have had things they just didn't tolerate it didn't like it was uncomfortable, something like that. And that's true for other kinds of implanted medical devices as well. So that's a pretty low occurrence, but probably not a true allergy. Well, it varies, and it is very weight dependent. So by that I mean that there is a threshold weight for all of us probably, above which we will no longer be able to control our blood sugar and we become diabetic. But if we can slowly drop down below that threshold weight, then the blood sugar becomes controllable and normalizes again. So we don't know where that is for you exactly. Some people have an idea because they've gone up and down above and below that threshold, and so they know if they can just get below 250 that they can control their blood sugar without medications. So the answer is, how fast will you lose the weight? And you are in control of that far more than I or any study is. I've had some people, I had two patients who came together. They were both supporting one another, two women who came from out of town and said they both wanted to lose 100 pounds in a year, and they wanted the lap band. And I said, you can do it. It's more than most people would lose, but you can do it. There's nothing stopping you. But what you have to do is to make a plan to lose that much weight. And I told them how to do it. I gave them the tools. I talked to them about the diet. We calculated out some calorie objectives for them. They had to lean heavily on our whey protein-based shakes and meal replacements, appetite suppressing, very effective at helping people lose that weight, but hard for people to stay on it long term. They have to be very committed to it. And they were, and both of them did succeed in achieving that goal with the lap band. So that's more weight than most people do lose with it, but it's just an example of what you can do if you set your mind to it. So I would say the harder you work at it and the faster you lose the weight, the sooner the diabetes goes away, is the bottom line. The question is, how about flying or air travel with the lap band where the pressure changes affect it? And I don't think it would affect it. Airline cabins are pressurized cabins. They're pressurized to around this sort of atmospheric pressure that we live at here in Reno. So it's probably not something that you would really notice. I've had, of course, hundreds of patients who've had lap bands and travel and things like that. So I don't think it would be a concern. Well, there's a couple of ways. One is that we'll help you. We'll tell you. We will give you guidance and a schedule to follow in the beginning. And as you come and see us, we will be asking you to come back every so often. We may tell you to come back in 6 or 8 weeks, or we may give you a little bit longer break and have you come back further down the road, depending on your weight loss goals and your weight loss success and how things are going for you. Then over time, we want you to continue to come back at least annually, but it may be that you want to come back sooner. And the kinds of things that you might think about that would indicate you need a band adjustment are that you're feeling hungrier, your weight loss has plateaued or stopped, or worse, you've started to regain some weight, or you're able to eat more things that you weren't able to eat before. All good reasons to come back and see us. Some of them good reasons to have a band adjustment, other times just to check in and get some feedback, follow-up, and coaching. What physical limitations are there with the lap band, if any? And I would say generally there are not physical limitations with the band. It's very unusual that people have any specific physical limitation. I've had some patients who are very active in all kinds of sports, including some who are involved in kickboxing and other sort of martial arts, and with rare exceptions have not had any special troubles with it. There may be some things in some people where the port itself that rests on the abdominal wall of the muscle could be something people are aware of with certain activities, or if they're in a real vigorous high contact sort of sport. Not common, but it's certainly possible that people would be aware of it. Very hard to do any damage to it or cause any trouble, so it would just be... Yeah, I think that's okay. I think skiing and snowboarding and all those things are fine. Yeah. Do people have the lap band removed? For example, after a certain period of time or after successful weight loss, do people have it removed, or should we think about just removing it somewhere down the road? It's a great question. Right now, I think the dominant thinking, in my opinion, is no, we probably should not remove it. And I base that on some studies that have come from other kinds of weight loss interventions. For example, there have been studies that looked at taking weight loss medications over a prolonged period of time and then stopping the medication. And what we found was that people regained their weight. If it was effective for them, they regained weight. So I think that there's a very high likelihood that unless something dramatic changes in the environment or in a lot of other factors that are going on, taking out large numbers of bands in people is going to lead to a lot of people regaining their weight over time. It's not that there aren't people who can change their habits and make a go of it and be successful, but we know from extrapolating to other data that's a very small percentage of people that we would expect to be successful. So in general, I would say plan on keeping it in forever. The question was that if someone becomes pregnant, is it necessary to remove the lap band? And generally speaking, the answer is no. In fact, most of the time, really, nothing special needs to be done. For a few people, though, it may be helpful to take fluid out of the band. Even this is a little bit controversial, but some people, if they're having a lot of trouble with vomiting in pregnancy, they may be better served just taking the fluid out of the band and leaving it as loose as possible during pregnancy. My feeling is that generally speaking, we ought not to be going out of our way to take a lot of fluid out of the band at pregnancy, unless it's necessary because of swelling or edema or this problem. What we're seeing quite a lot around the country is that women are gaining far too much weight during pregnancy, and that this is setting the stage for lifelong obesity. So it's a real problem that we see very commonly. And I think one of the things that we need to be better about as doctors and as advisors to women who are pregnant and becoming pregnant is that very limited weight gain is the word of the day. Don't gain lots and lots of pounds with pregnancy. Keep it down to 10, 15, 20, 25 pounds. More than that, even by the Institutes of Medicine, is not healthy, and it leads to long-term weight gain and obesity. So generally speaking, no, the band does not need to be removed during pregnancy. Here, the main concern arises after gastric bypass surgery. From those studies, there has arisen a recommendation to avoid pregnancy during the first year to 18 months, 2 years, even some authors would recommend, after Roux-en-Y gastric bypass surgery. The thinking is that during that period of very rapid weight loss, that's not the best biological environment for a newly developing baby. And there could be potential for nutritional deficiencies in the baby. There's not been troubles associated with the lap band with pregnancy, and generally speaking, after that initial period in gastric bypass of the rapid weight loss, beyond that, it's certainly safe to have pregnancies. In fact, there have been many studies looking at weight loss surgery and pregnancy, and all of them reach the same basic conclusions. One is that women are far more likely to become pregnant. They become more fertile. They have more successful ovulation cycles. And the second is that there's a marked reduction of the risks of pregnancy, both to the baby and the mom, after weight loss surgery, because, again, obesity is such a risk factor for obstetric complications for both mother and baby. So those are the main findings. But yes, if you had gastric bypass surgery, we'd want you to strictly avoid pregnancy during the first 18 months and have a real clear plan to avoid it. And after that, be okay. And with the lap band, no special concerns other than limiting weight gain. Good question. The question is, does alcohol cause damage to the gastric bypass or perhaps to the lap band, just to widen the question a little bit? And the answer is that yes, alcohol, especially in large quantities, is dangerous after gastric bypass. Alcohol is like nonsteroidals, Advil, ibuprofen, Aleve, in terms of it causing ulcers. I wrote and we reported a paper on ulcer formation and perforation after Roux-en-Y gastric bypass surgery. That's been an influential paper to help people avoid Motrin and help other surgical programs avoid nonsteroidals. But also in that paper is a recommendation about avoidance of alcohol, because we did have one case in that series that involved alcohol abuse and an ulcer perforation. So the short answer is yes, if someone were to begin drinking alcohol heavily after gastric bypass surgery, this would be a significant risk. It's a significant risk of ulcer formation and life-threatening ulcer perforation, as was this one case we reported. Not a special risk after lap band surgery. So the lap band is not known to increase the risk of ulcer formation because there's no cutting on the inside lining of the stomach. So alcohol still carries all its normal risks. It still is a potential causer of ulcers, just like it would be for me and you and people who have not had any stomach surgery. But that risk is not elevated after lap band surgery like it is after gastric bypass surgery. First of all, I would say that just about everything can be crushed, and certainly acetol would be biologically effective if it were crushed. And most medications are. There are a few time-release medications or what are called extended release medications that it'll change their absorption if they're crushed. And so generally speaking, what's recommended is to switch to the regular release variety of that medication. For example, a number of the blood pressure medicines like Cardizem have two versions, one that's the extended release and one that is the normal release, but it requires taking it 2 or 3 times a day instead of once a day. So the pharmaceutical companies have made some medications daily, once a day medication because it's easier for us to take them once a day. But it may be necessary in those cases to change to the more frequent daily dosing, and yes, then go and crush them up. In addition to that, I would say that you can also swallow most pills. So the toughest thing is just in the very beginning, after either surgery, when things are very snug and tight, it may be a little bit tough to swallow big pills. But as time goes on, most people can swallow most of their pills and medications and absorb them just fine. If it's a real big pill, it may be a little tougher, and you might want to look into ways to get around that. And just about always there is a solution. They can be crushed, capsules can be opened, medications can be converted to liquid forms, time release, sublingual. There's many, many options. So in a rare case, it requires a little bit of work and talking with a pharmacist and doctor to find a solution, but there's always a solution out there. So that's the bottom line. Okay, well, I'll stop right there. Thank you very much for your time and attention. I wish you all tremendous success in this weight loss journey. It's probably the most important thing that you can do for your health is to lose this weight and keep it off. And if we can be helpful to you in that, if I can help you succeed in achieving that goal, then I would be very honored to do so. So thank you very much.